Portascan Plus, an easy-to-use automatic real-time bladder scanner from Mediwatch plc. The Portascan Plus is a portable device for measuring the volume of liquid in the bladder. The real-time image also provides the ability to perform basic diagnosis and assessment of the bladder and other abdominal organs. The process of the bladder filling with urine excreted from the kidneys can be observed by placing an ultrasonic probe on the abdomen. This not only gives a picture of the bladder, but also the bladder volume, which can be measured from the image on screen. Ultrasound works by picking up reflected high-frequency sound waves. These travel very well through water and are not reflected, so the bladder appears dark. On the other hand, hard objects reflect the waves, so that, for example, a stone appears bright on the surface and casts a shadow beneath it. Air does the same, which is why we have to use gel in between the probe and the skin. At just 3.6 kilograms, Portascan Plus is a lightweight, go-anywhere, use-anytime bladder scanner. The large high-quality 8.4-inch color LCD screen provides clear real-time images of the bladder, whilst its simple point-and-measure technology provides one-touch automatic calculation of the residual volume. A full ultrasound image of the bladder is displayed, allowing for optimal picture orientation. A single touch of the freeze button confirms the outline of the bladder. The intelligent software then analyzes the scan, draws round the bladder, and automatically displays the volume, removing the uncertainty as to what you might have just measured. The onboard thermal printer prints the scan and the calculated results, whilst the Portascan Plus's internal memory allows you to store and record up to 250 scan images of previous patients. The unit comes complete with a replaceable, rechargeable battery pack, a charger, and a carry bag. Take a look at your probe. On one side, you will see a blue button, which freezes the scan. At 90 degrees to this is a black dot to mark the transverse plane. With the black dot facing towards the patient's right side and the blue button to their head, you will get a transverse scan. To perform a sagittal or longitudinal scan, point the black dot to the patient's head and the blue dot towards their left side. Press the button on the back of the unit to start up the scanner. The scanner goes through some internal checks before it is ready, and it'll take approximately 90 seconds to complete these. Turn it on as you're preparing the patient. Get them to lie flat and relax, and start with the probe a couple of finger breadths above the pubic symphysis. Apply a squirt of ultrasound gel to the head of the probe or directly onto the patient's abdomen. Press either the blue probe button or the scan button on screen to begin scanning. Start with the transverse view. Ensure the black dot is facing towards the patient's right side and the blue button to their head. The bladder should be found on the patient's midline and is best viewed at a slight angle down towards the rectum. Move the probe up and down, left and right, and at different angles to get the largest view, with the bladder in the center of the screen. The bladder is the dark area coming and going as the probe is moved. If the bladder is too small or too large for the screen, press the depth buttons to obtain the optimal scan image. When it is at its most prominent, hold the probe steady and press the blue probe button again or the freeze button on screen to freeze the image and calculate the volume. The Portascan Plus identifies the bladder by drawing a line around its outline. If for some reason you suspect that a better picture could be found, then repeat the transverse scan until you're happy. If you feel that the automatic calculation could be improved, then touch the screen to mark 2 or more points on the bladder edge and press volume to recalculate it. A transverse scan provides a quick and simple estimate of bladder volume. For a more accurate measurement, complete the volume measurement by doing a sagittal scan as well. Press the sagittal scan button and rotate the probe 90 degrees, ensuring that the black dot faces the patient's head and the blue probe button is on the patient's left. Once more, adjust the position of the probe to get the best and largest image. Press the blue probe button or freeze button on screen again to calculate the combined result. As with the transverse scan, if you feel that you can obtain a better picture, press the sagittal scan button again to repeat this part of the scan only, or mark points manually and press volume to recalculate. A transverse scan of most bladders is roughly square, especially in women, but the sagittal scan is more of a triangular shape. You'll use exactly the same procedure to scan both men and women. For pediatric scanning, increase the probe frequency from 3.5 MHz to 5 MHz. Press the print button to obtain a hard copy of the scan image and the bladder volume and secure it in the patient notes. Press the Save Image button to add the on-screen image to the internal database. As well as changing the image depth and the probe frequency, the buttons around the screen allow you to change the screen brightness and contrast, so you can see the image more clearly. When you've completed your scan, switch off by pressing the shutdown button. As the battery life runs down, the voltage bar on the screen will change from green to red, which will take between 2 and 3 hours. The scanner may be safely used while being recharged, or a new battery can be inserted as needed. Store the probe in the compartment and close the lid to secure it while moving. All the accessories will fit in the shoulder carry bag. The Portascan Plus can be used as a straightforward bladder scanner or can be used as part of a more advanced system. Press Switch to Advanced mode and then the menu button to allow you to enter patient names and IDs, save and recall up to 250 images to an onboard database, scan the kidneys and other abdominal organs and assess other conditions, connect to a Mediwatch portable Euroflow to produce a one-stop system, generate complete reports for patients, transfer data to a computer running Mediwatch software. Portascan Plus, an easy-to-use, automatic, real-time bladder scanner from Mediwatch plc.